With all that's going on, we are definitely not taking our eyes off of COVID-19 and the Delta variant either, which shows no signs of slowing its spread across New York State. Tompkins County, one of the first upstate counties to reach the substantial transmission, according to CDC data.
So joining us now is Amie Hendrix, Deputy Tompkins County Administrator. Amie, thanks so much for joining us tonight.
Thank you.
So, Amie, I want to start here. Tompkins moved very quickly to follow the CDC guidelines and ask everyone to wear masks again inside, regardless of vaccination status. Not every county is doing exactly that. So what went into your decision for Tompkins County?
Yeah, so on Friday, we knew that we were seeing reporting 59 active cases on Friday afternoon. Following that CDC guidance that had been issued earlier that week, realized that we were having 50 cases per 100,000 residents, and it was time to follow that advisory. So we chose to do that, and we decided to put that advisory out and ask all of our businesses, our organizations, our own employees, and the community as a whole to go ahead and start masking up again, no matter their vaccination status.
Well, Amie, we know that you are among the leaders when it came to vaccination rate. So how did Tompkins County go from a high vaccination rate, which obviously still exists, to also being in a substantial transmission range?
Yeah, so, you know, it's all about partnership. So vaccinations are very important, but so is mask wearing and maintaining that social distance and being diligent about hand washing and the other hygiene practices, as well as staying at home when you're not feeling them. And so while we know that vaccinations are working, there's still spread. And so we're seeing that disease spread, and we're going to continue to push on both masking and vaccination and encouraging those who are not vaccinated to go ahead and still follow through with that vaccination. We do have a high vaccination rate, but it can always be higher.
Where would you say, Amie, if you could kind of classify, where are the cases coming from the most? Are these new cases? What are we talking about here?
So we're seeing a lot of cases related to travel. So going outside of the community, contracting it there, bringing it back into the community, and then indoor gatherings where people are not masking up or are in close proximity with one another for a long period of time.
And let's talk about on the college front. How important is it for Cornell and Ithaca to continue mask wearing and to mask up?
Yeah, so we have 3 higher ed institutions here in Tompkins County, and all 3 have followed suit and asked that their students, faculty, and staff will mask when they come on campus. We have a great partnership with all 3 higher eds, and we continue to value that partnership. When we chose to go ahead with this mask advisory, it was soon after that both Cornell and IC released their similar messaging, and TC3 also.
Amie, what would you say has been the overall response, though, from the community? Do you see a lot of businesses going along with the mask rule? Are people following it? Obviously, you can't necessarily see inside their houses, but what's been the overall kind of community feeling you've been getting or hearing?
So it's been actually well received. I will say I know that people are tired. I think we're all tired of the pandemic in general, but we have done a lot here. We've seen a lot of progress with vaccination. We've seen disease spread slow down. Yes, it feels like another setback, but I think overall the community is kind of taking it in and really are masking up. We're seeing businesses starting to encourage all patrons to do so. While it's not mandated at this point, I think that there are a lot of masks appearing everywhere, and it's really moving forward.
All right, let's talk a little bit more about the business community. You see them requiring masks, but do you think restaurants, gyms, stores are going to vaccination-only policy?
I think it's something that a lot of places are starting to consider. I know that people are considering it first, maybe for their own staff. There's a lot of conversation around it. I don't know that I've seen anyone completely go there yet in Tompkins County. But there is a lot of conversation and looking at the effectiveness of the vaccine and how it does prevent severe illness and death in most cases. It really is something that I think we're going to continue to see a lot of people consider.
Amie, crystal ball kind of question to wrap things up here. How long would you think that you'll be in that, so hopefully it doesn't rise to a high, but you remain in that substantial, try to get it down to a moderate or hopefully even lower than that. So how long do you think people will need to be in mass indoors, or is that just too hard to really put a number on? Is it basically short term, or are we looking at least a few weeks?
You know, I think it would be wonderful if any one of us had a crystal ball when it comes to this pandemic. We have seen increases and decreases. We've seen 0 case days, and then we've seen increased case days, double digits once again here in Tompkins County. I don't know how long this is going to go on. We're having a lot of conversations about how we continue to approach this. I mentioned before, I think people are getting very tired of doing this, but it's all about protecting one another and respecting one another. And so for now, we're in it for the long haul, and it's the only way to prevent those who are most vulnerable in our community from really getting sick. So I'm going to continue to encourage it, and hopefully, you know, crystal ball prediction, it won't last forever. It'll last for maybe a few more months, and we'll be able to move on and really talk about post-pandemic, but we're not there yet.
Right, all about protecting each other. Amie Hendrix from Tompkins County, thank you for joining us tonight.
Thank you both.